My name's Heather Chappelle, and I work on the information desk. I give out room numbers and direct people to where they want to go.
So my name is Karen. I'm a volunteer at Ross Memorial Hospital here in Lindsay on the lottery desk. I've been here for almost 8 years. I sell lottery tickets. So I come in the morning, I set the stand up, I get the tickets out, I get the cash flowed out. I try to sell tickets to, lucky tickets of course, to most of the hospital staff.
Ann McFadden, and I've been a volunteer for 54 years. I'm working in the gift shop and I sell merchandise.
Beverly Newman, and I've been volunteering here about 8 years, I think. I help in the gift shop in the retail part and enjoy meeting the people and seeing all the wonderful merchandise that we have.
Bob Lindsay, and I have been volunteering for this fall. I will get my 10-year pin. I'm just volunteering to merge, ensuring that the patients get in to see the triage nurse and or line up here. I'm the first person they see when they come in.
My name's Ross Beatty, and I've been here, I would say, going on 5 years volunteering. I'm working with the HELP group, which stands for Hospital Elder Life Program. And I was involved with it starting initially about, I guess 2.5, 3 years ago, I guess. So.
My name is Queenie Ray, and I have been volunteering, I think, for 5.5 years, 6. I'm just a volunteer at the information desk.
I'm Robert Easton, and I guess it's going on for about 2.5 years at this point. I'm Director of Finance. I overview the finances for the board.
My name is Barbara Harrison. I've been with the auxiliary 16 years.
My name is Angie, and because it's a brand new program, I've only been volunteering for 2 months. But prior to my stroke, I actually worked here as a registered nurse for 26 years.
Okay, my name is Mary Griffin, and I've almost got my 10 years in. I was in the cafe for about 8 years, and then I decided to sit here and look beautiful and tell everybody where to go.
I'm Gloria Connell, and I volunteered here. Be 5 years, probably in about September. I'm just a volunteer in the cafe.
I'm Gail, and I'm assistant to the assistant manager of Reflections Gift Shop.
And I'm Karen, and I'm the manager.
And I'm Shari, and I'm the assistant manager of the gift shop.
My name is Pat Presley, and I've been volunteering with the Ross Memorial Hospital Auxiliary for 14 years. And just started recently on the tuck cart. Only been on the tuck cart for 3 or 4 months. The tuck cart, we take it around to all the patient rooms and have a short visit. And if they need something off the tuck cart because they're unable to get to the gift shop, we're there to meet their needs.
My name is Norman Houghton, and I've been volunteering about 1.5 years. I volunteer in the admitting department. I take patients that come in to be admitted to the various departments close by, day surgery, ambulatory care, fracture clinic, pre-op, and lab tests.
My name is Heather Newman. I've been volunteering for about 19 years now.
My name is Paul Davies. I've been here 2 years, volunteering for Ross Memorial.
Name is John. I've been here maybe 1.5 years. Started in dialysis, and I decided I would like to do something else.
Hi, I'm Lola Detman, and I've been volunteering for 14 years now. I work in the diagnostic imaging, specifically in the breast screening area. I help the girls out in there.
Dennis Roy, volunteering 12 years. Help with patients, talk with patients.
Well, I've been involved in a couple of the lean studies, ensuring that what we do is the correct way and the short way.
I think the best moment is coming because it looks like this is going to be a better year income-wise than last year. So it's looking good.
I was very pleased when Robert joined me in the finance department.
The best moment I've had volunteering so far is when I had a patient say that he was suffering from left neglect, which is where you can't see anything on your left side. I also had that condition following my stroke, so I was able to give him advice that I had learned through my journey on how to safely walk around. And a few weeks later when I came in to see him, I showed him that I had gotten my driver's license back, and he just beamed because it gave him hope knowing that I had had what he had and I had come so far.
Well, every day is a surprise. You never know what you're going to come across. You meet such lovely people by sitting here and saying goodnight to everybody when they leave.
Oh, just joking around with the nurses. Yeah. And even the patients.
Oh gosh, I don't know, there's a lot of moments. Just being here is fun, and knowing everybody.
The best moment was I was setting up a couple of patients for lunch. I got them laughing, and the one patient decided to laugh so much her teeth flew out and went across to the other patient on the other side of the table. And the other patient says, "I really don't want these, I don't need them." And she threw them back.
When the three of us get together, there's a lot of laughter. So those are really good moments. And working with our volunteers, we've got some excellent volunteers, and we have a lot of fun in this shop.
I've been in public service for 30-some years, and giving back at this location was something I thought I should do.
My wife's been here at the hospital for, gosh, probably 16 years volunteering, so I said, oh, well, I'll come up and see what's going on. So
It was something that I always wanted to do, and I thought this would be a very pleasant place to come to.
Well, about 3 years ago, I came into emergency, and I was very impressed with the way everything was handled. I just decided afterwards to find out if there was anything I could do to volunteer.
So what inspired me was when I was told about the program. I felt that it was a perfect fit for me because when I was going through my recovery, I wished so much there had been a program like this in place. And so now I can be that person for all of the patients on the integrated stroke unit.
My daughter is a nurse in ICU, and they needed somebody to early in the morning to serve coffee.
I've had relatives in here that have been sick, and I knew they needed help, and I like working with the public.
Well, I guess I got to the point where I felt I should give something back to the community.
I was always taught by my mother, you give back to your community what your community's giving to you.
Because I used to go to a group here, and I thought I'd do a little payback by volunteering.
Actually, my husband, we retired from our business, and he knew this is what he wanted to do. He totally came over, I think, a year before I did, and he was having so much fun and enjoying it. I knew I needed to be part of it as well, and yeah.
It gets me out of the house. I enjoy being useful. Yeah, you get to know a lot of people, and I just enjoy it, basically.
Best part about volunteering, meeting people, feeling that you're doing something worthwhile.
Get you out meeting people. Whether the weather's good or bad, we come and keep the shop open and see all the lovely things that the volunteer gift buyers buy.
I enjoyed here. The people are good, the nurses are excellent.
Oh, I just love meeting people, and I like to talk a lot, so that's my problem. so I get away with it. Poor people have to listen to me.
I think meeting people, getting out, and realizing that you're helping the community.
The best part about volunteering is being able to use my stroke journey to help those patients that are just beginning their own journey.
Meeting people. I love meeting people.
In our case, it's the satisfaction of making a profit in this gift shop so that we can turn the money over to the foundation and buy equipment.
It's rewarding, and again, keeps you busy.
Trying to put on a happy face and make them feel light and comfortable.
All the people I meet, the people I meet in the hospital and the kids, the teenagers coming in, we've had some super good teenagers, and it's nice to see.
When people say thank you, and they really appreciate what you do.
Seeing a smile on their face.
Just being able to give back to the community and the hospital per se. Everybody's very welcoming, and it's very rewarding as well.
Just meeting other people, meeting the patients, interacting with the nurses. Kind of helping people out. And it keeps me active. Gets me out of the house.
What advice would I give someone who's thinking of volunteering? Do it. Do it. Spend as much time as you can helping the community to grow and to be as vibrant as possible.
Don't think twice about it.
The best thing to do is help anywhere you can. You know, that's always sort of been my feeling, that wherever you can help out, that's it.
The hospital is a wonderful place to come to. They're always looking for volunteers, and it's very pleasant working here.
Volunteer, absolutely. Just tell them to volunteer and decide where their interest might lie and come and volunteer.
Well, I think it's great if you have the time, and it's a super organization to belong to. Everybody's friendly, and we all work together as a team.
Well, my advice is to get off the chair and start doing something, and you'd feel a lot better. And if you look around and see how sick people are, then you'd feel 100% yourself.
Make sure you have the time, because it is a commitment.
I'd say do it. It's a great, rewarding experience, and you'll never regret it.
Well, make sure it's kind of what you want to do, and be open, be friendly, and try and do the best job you can, and try and stay with it.
Oh, I would say do it. It's great. You get, especially for us, we were new to the community, and it's a great way to get to know people, and then, like I say, feel part of the community and feel rewarded as well to come know you're helping out society and the people in general.
It's what you take home from it. The feeling you have of helping somebody have a better day.